Uganda first got Ebola outbreak in 2000 and the epicenter was in Gulu and Mbarara. Health workers at the time were treating quinine-resistant malaria until the cardinal signs of bleeding in different openings came up. This was the Zaire strain, which saw 224 people die out of the 425 cases in Gulu district. The current Ebola outbreak in the country is for Sudan strain, which is a bit mild. The epidemic, according to experts, is taking a linear path with cases in direction of Chegego.
I would be more worried than if it now starts, we pick another case in Rakai, in Mukono, off that grid. It shows that people are now penetrating into the community, and that makes contact tracing
very hard.
Quite hard. Whoever we are looking for is taking that linear path, either jumping into a taxi, either walking, and that means it has not yet disseminated off very far from the epicenter.
The Director General, Health Services, Ministry of Health, Dr. Henry Mwebesa, said they had started to align the current epidemic to DRC or even Sudan, but the first Ebola case was for a local person who had no history of traveling to Sudan, emphasizing that Uganda has its own pathogens.
But what I'm saying is that the problem started within. So most likely, these people got into contact with monkeys, with bats, with all those animals that harbor the viruses. So, and most likely in the caves, in mining areas, that's where the problem is.
An expert from Makerere University, Dr. Ombeva Malende, said this particular outbreak of Ebola is for a Sudan strain, which is a bit milder, unlike the previous Zaire strain, which has a case fatality of 90%. However, the issue of vaccination and treatment of Sudan strain remain questionable since the available vaccines and medicines developed are against the Zaire Ebola variant.
So the Sudan strain is a bit milder, which is something to, maybe I should say, is that we are fortunate in the sense that our capacity can be able to contain that. So the ones who have died are the ones who, like Dr. Mwebesa said, they're those ones who maybe were found towards, as they neared death. They're the ones that raised the alarms. And then led us to be able to test. The Johnson & Johnson vaccine, there is a small, how do I call it? The glycoproteins. There's a small component in it that is supposed to actually cover Sudan and Thai forest and Wodujo. It to be tested in a research environment. The research environment has been done on the Zaire strain. It has not been tested on the Sudan strain. You need to challenge is usually this. To test these vaccines, you actually need an outbreak. You will not test the vaccine if you don't have the problem going on.
About vaccination, it is not like the COVID vaccination that everybody will be vaccinated. The vaccination is only the people who are in immediate risk or contact.
Okay.
The frontline workers, who could be security, who could be health workers, and those contacts who were contacts to the people who got
infected.
And then contacts of contacts. We'll call it ring vaccination.
High contraction of Ebola by health workers in Mubende has been attributed to reluctancy by health workers to utilize PPEs. Ministry of Health reveals that they have adequate stock of masks, overalls, and disinfectants.
Creating awareness amongst our health workers to ensure that they utilize these PPEs, because many times when you go to facilities in Mubende, I could not believe that even as much as there were Ebola patients in that hospital, some health workers in the outpatient department were actually not using the PPEs that are being provided.
During Behind the Headline program, officials of Ministry of Health were advised to consistently prepare and start mapping areas which have people who eat bats and build capacity of the communities. They were also challenged to up their game in communication during such outbreaks to prevent misinformation.
Manpower, in terms of the knowledge, in terms of how we can manage, I think we have that.
Okay.
Based on the experiences. I think the ministry needs to consistently keep on. We don't need to relax. There are people who eat rats in some parts of the country. There are people who eat monkey. There are people who... So if we are getting from this, you know, from bats and all that, what about tomorrow if we have an outbreak in Amuru?
Yeah.
Okay.
So we should start mapping these areas, preparing and building the capacity of the community, but also the health workers in those areas.
Okay.
All really is to the health personnel to take leadership on communicating and sensitizing people. Association, Uganda Medical Association, saying if there are no PPEs, they are calling on the doctors to withhold their services. That is another dangerous vacuum that you need to cross. That is a dangerous gap. My namesake here said they have enough PPEs. Already the medical personnel are infected, and the medical association is saying withhold services until you get PPEs. So which is which? And if you have PPEs, how come the medical association doesn't know?
A multi-sectoral approach, especially on issues of communication and sensitization, with support from non-government organizations, has been emphasized in managing epidemics. I'm Nafka Farida in Kampala.